Hi everyone, my name is Jacqueline Frager. I work as a phlebotomist inside of a hospital. I know a lot of people that go to Goodwin are looking to get into the medical field, so I'm making this instructional video today about the steps you take while drawing a patient's blood. First thing you do before you even enter the room is you gather all your appropriate supplies, including your tourniquet, your needles, your gauze pads, your alcohol wipes, and the vacuum cleaners. You should also always look for precautions before you enter a patient's room. The person may be on isolation, and if you need to wear a gown or a mask, you need to know that before you enter. You should always wear gloves, always wash your hands, and always wear gloves while performing a venipuncture. So, when you enter the room, there's a lot of people going in and out of the patient's room all day, so you need to properly introduce yourself. Just a simple, "Hi, I'm Jackie, I'm here from the lab, I'm going to draw some blood today," and be okay. So when you draw your blood, the first thing you use is your tourniquet. The tourniquet prevents the backflow of the blood to the heart, making it easier to find the veins. Depending on where you're drawing the patient, some people you have to draw them in their hand, and others you draw them in the antecubital area. You place the tourniquet on about 3 to 4 inches or 5 centimeters above the site you're going to draw. Most of the time, we draw right here, and the tourniquet will go around here. So, what you do is you just wrap it around and you pull one end through. You do it tighter, of course, but just to show, like that. So, and then when you pull, it easily comes undone. Once you do this, and this is on tightly, you can palpate for the veins in the patient's arm. You don't want to use your thumb to palpate because your thumb, you can feel your own pulse in it. I like to use my index finger. Now what you're looking for is you're looking for like a firm rebound. Veins are spongy, so when you press down on them, they'll press back up at you. So I have one right about there. So once you find the vein that you're going to draw the blood from, you have to clean it thoroughly using an alcohol pad. The alcohol pad will get rid of any of the germs, and you just use the alcohol pad in a circular motion to get the whole area. Once your area is clean, you can choose your needle type. There are 2 different types of needle. One is your standard one. Looks like this. There's the needle under there. I don't know if you can see that. That's one needle. And then also for other patients, we have a butterfly needle. I'm sure you guys have seen these if you've ever gotten your blood drawn. The needle's under here. You use a butterfly if you're ever drawing in the hand area, or if you're ever drawing on a young child or an elderly patient. Sometimes their veins aren't as good as young people's, and they're harder to get into, so this would make it a little more easier to use a butterfly needle. Once you decide what type of needle you're using, you take it off and you just inspect it a little bit, make sure there's nothing wrong with it. There is a little bevel on it. The bevel has to be side up when you go into the vein. So, you put the needle at about a 15 to a 30 degree angle, like right into the vein. If you miss, it is possible to redirect it, or also if you go through the vein, that is also okay as long as you pull back, once you pull back on the needle a little. What goes into this would go into right here are your different tubes. These are some of the tubes we use in the hospital, and they simply are called whatever their top is. So this would be your light blue tube, your lavender tube, and your gold tube. These are all different because in the bottom, they have different ingredients. So some you would use to separate plasma, some are anticoagulants, some would separate your serum. So those are the little things in the bottom of these. So, once you have your needle in your arm, what you do is you simply push this into here. This is a vacutainer, meaning once there's a needle inside here as well, that dark line, that's also a needle. It's going to puncture this and blood will start to flow into the tube. Once you've filled all your tubes, some of them, every tube depends, it varies on how much blood you need to draw the test that the doctor's ordering. Once you do all that, the first thing you remove is the tourniquet. You simply just pull the tourniquet, and after the tourniquet, you take out your tube, and then you would take out your needle last. This is a safety device. Once you are done drawing the patient, you just click it, and you would throw this into your sharps container because this is a needle. Your tubes, they need to be inverted in order to mix the blood with the additive at the bottom. Most of them need 8 times, and you simply go like that. You don't have to shake them vigorously. Okay, and then gauze. You should always put gauze over the patient where you drew them. Make sure that they stop bleeding before you leave the room, especially elderly people. And you would just put gauze and a Band-Aid over the site. And now you have your blood samples and your patient is ready to go. And just thank them before you leave. I hope you have a good day. Thank you for letting me draw you. And you're all set. And those are some simple steps you use while you're drawing blood. Thank you.